I Believe podcast. I'm Megan, and I'm so excited you're here. Thank you for joining us today. We have some great information for you. Today we have Dr. Jose Lutzky from the Sylvester Comprehensive Cancer Center in Miami, Florida, and we're going to tell you all about how he can help you or someone you love. Dr. Lutzky, can you tell us more about your uveal melanoma program?
So here at Sylvester Cancer Center, we see a large number of patients with uveal melanoma. Unfortunately, a lot of these patients eventually develop metastatic disease because of the nature of the disease. We have a very robust clinical trial program as well as a translational program. In addition, because of where we are located in the country, we see a lot of patients that come from Central and South America that are looking for options to treat their advanced disease.
What makes a patient a good candidate for your program?
Yes, we like to have clinical trials and options for all patients that need treatment, but unfortunately, sometimes patients come to us too sick and they're not able to be part of a clinical trial or even to withstand a standard treatment for the disease, but that tends to be the minority. Most patients will be able to fit the requirements or what we call inclusion criteria of one clinical trial or another clinical trial once they have exhausted the standard of care treatments.
Oh, that's really great to hear.
Usually are able to help these patients.
Tell us about your international program.
As I mentioned before, because of our geographical location, we do see patients that come from Central and South America. Unfortunately, in a lot of these places, patients do not have a lot of options to treat uveal melanoma. Uveal melanoma is rare, so a lot of these countries in Central and South America do not have the expertise or the resources to effectively diagnose and treat uveal melanoma. And patients have a difficulty in finding medical centers that have specialized ophthalmologists and oncologists that have experience in managing these cancers. In addition, other than some of the standard therapies, a lot of these centers in South and Central America cannot offer much beyond the conventional treatment. And even some of the conventional treatment drugs that are approved in the United States, for example, tebentafusp, are not approved in a lot of those countries. So patients sometimes come up here just to get what we would consider standard of care treatment. There are issues. These treatments are expensive. They usually involve surgery, radiation, sometimes immunotherapy. And patients had to also deal with the travel costs, the medical expenses, the insurance coverage limitations if they have insurance. And when they get here, in addition to try to get a visa, they need to arrange transportation, need to find accommodation. So that is all very, very difficult and stressful for these patients. They feel more stress and anxiety. They may feel isolated because they feel that they're in a place where they cannot get the treatment that they need. So that generates a lot of them.
And what are you seeing that's giving you hope?
If you asked me this question 5 years ago, even 5 years ago, I would say that we don't have enough clinical trials. We're not seeing a lot of progress. But today, I'm happy to say that that is no longer true. We have an immunotherapy drug that is approved specifically for uveal melanoma. It's something that we have never had. They're called tebentafusp. And we're seeing additional progress in the area of immunotherapy, particularly with cell therapy. And cell therapy is when we take immune cells from the patients and give them back to the patient after we modify even the immune status of the patient or the cells themselves or both. For example, there's some good hope in TIL therapy called tumor infiltrating lymphocytes in uveal melanoma, and there's research that's being done in Pittsburgh that's showing some benefit there. We are doing a number of trials with engineered T cells in which the immune system warriors, the T cells, are taken from the blood of the patients and they're modified to make them warriors against specific targets in the uveal melanoma, and we're seeing a lot of progress there. We are also doing trials for patients that have disease that's mostly localized to the liver, which is a very frequent site of involvement in these patients, and trying to modify the immune environment in the liver to fight those cells, and we're seeing some progress there as well. So I think there's just a much more optimistic sense in the research community that, like we have conquered cutaneous melanoma to some degree, we would be able to make progress in uveal melanoma as well. However, it's a rare disease. Clinical trials take a long time because we don't have that many patients. But I think we're moving forward at a much better pace than before.
Once a patient's diagnosed, how quickly do they need to find a specialist like yourself? And then what's the timeline?
I think it's really important that someone that is familiar with uveal melanoma and has treated and diagnosed with melanoma sees the patients as soon as possible. I think for many years, a lot of people would say, oh, it doesn't really matter because there's no treatment, so there's no need to follow these patients. But particularly in other countries, the main form of primary treatment of these patients is to do enucleation. Patients get to the doctors that can treat them too late. The disease is too locally advanced. So they lose their vision unnecessarily, because now in the US, at least most of these patients are treated with radiation therapy, with brachytherapy, and that saves their vision. And there are ways now to prevent radiation-related loss of vision that may not be available in other places. So I think it's important that they find an ocular oncologist, wherever they are, that has experience. If they don't have an ocular oncologist, with technology today, you can have a consultation in telemedicine with an ocular oncologist or with a medical oncologist afterwards to see what would be the right course of action. We can now, with specialized tests that are done, fine needle biopsies at the time of the treatment with radiation therapy to find out if this is the type of uveal melanoma that's likely to come back, or if this is a type of melanoma that most likely is not going to come back. And then you can tailor the follow-up plan according to that. That's tremendously important. If someone has a very low risk, they don't need to worry about it as much. But if they're very high risk, they need to be followed. They need to have scans periodically, because the sooner you find that there is a recurrence, the more likely that patient's chances of responding and living longer are. So I think it does make a lot of difference whether someone sees a specialist or not.
And how can we get these resources to the patients that are watching this?
I think once a patient with an international patient that we are talking about here is diagnosed with uveal melanoma, I think it will depend a lot on where they are. In some countries, there is specialized care, at least for the primary treatment. There are ocular oncologists that are well versed in doing the modern treatments. But what there isn't much in many countries is the care for patients that have recurrence or metastatic disease. As I mentioned before, there are no other approved drugs, and there's a paucity of clinical trials. There's more of that in Europe, for example, but for patients that come from Central South America, the African subcontinent, that also is a problem. So the best way to do that is once they've been diagnosed, they received the primary treatment, and they're found to be at high risk. I think that's the time to seek a consultation. Like I mentioned before, I think a lot of centers now are doing telemedicine visits with these patients. I don't think they need to, run to the United States right away. I think they need to talk to someone first, find out what the risk is. If there's anything going on at that time that could decrease that risk, that could only be done here. Or if there isn't, they need to be monitored properly. And if there is a recurrence, that's another point where they need to consult and see what's going on in the United States. We have an international office. We have an international office. So there's two ways. One is through the international office or through the melanoma program. Through our navigators, and the navigators, if it's an international patient, the navigators will will orient patients to go. They'll put them in contact with the international office. I actually think it's usually better to come through the melanoma program, because the international office sometimes can take longer than they need to. The first step, yes, it's to go through the melanoma program navigators, and we have two navigators that they usually help the patient, where to go. And if they're international, they go through the international office and they arrange for that. If they're not, they arrange for an appointment. Yeah, I think a significant number of patients, although not the majority, get incidentally found to have uveal melanoma. So if someone's in the habit of seeing an ophthalmologist and having their eyes checked once a year or so, I think that can help pick up these things relatively early. Unfortunately, the patients just present with loss of vision without any hint that anything is going on. But I think I've seen a number of patients in which this was picked up incidentally without any symptoms, and it's probably in a good 15, 20. And whenever there is any kind of visual symptom, not to ignore that, just not wait until they can't see anymore, and sometimes that happens. I think patients also sometimes sense there's something bad is happening and they don't want to know about it, and it's sort of instinctive.
Thank you so much.
Same here. Have a great weekend, you all. You're welcome.
Thank you all so much for joining us. This really means so much that you're here. This is why we do what we do, to help you, to bring this information to the community, to spread awareness. If you would like to help us do what we do, please consider going to our website. We have a lot of resources there. You can get involved. We have a Facebook group. We have a Tuesday night resource meeting, patient meetings, all kinds of things to help support our community. And to help fund us, if you guys would like to donate or join a 5K, we always need your help. It's so important to continue doing what we do, but we can't do it without you. So if you'd like to help us or join us, we would love to have all of you. So come be a part of our OMI family, and we'll see you next time.